almost nearing 80s, and whatever I say, what relevance it will have to you, I'm not very sure what I did 40 years ago or 30 years ago, but I think that could give you a message. Because all along, what I have tried to do is fight against the conventional things. Don't go through the time-tested path, which is normally very much long, delayed, and maybe unproductive. So out-of-the-box thinking and differently thinking and taking a different path, I have found has delivered the goods. For example, in 1983-84, I rejoined medical college after my stint of 3 years in UK. And when I joined, I was full of enthusiasm, and I wanted to do a lot of research, because I thought that's the only way you can succeed, because development comes only through research. When I shared my thought with my friends, they said that you are in a medical college where the radiology department has just an X-ray unit, not even an ultrasound, and you have a lab which has very preliminary investigations. And there is an ECG machine. If you want to do an ECG, you have to get the permission of the head of the department. So that was the stage when I decided to do research. But that doesn't put me back. I made a proposal, research proposal to Science and Technology Department, Kerala State. It was accepted. The first one that I did was making cryo lesions on the tumor bed, glioma tumors, and that is supposed to enhance the increase the longevity of life of the patient. So through that test, you should have liquid nitrogen for cryo lesions. And I searched, and ultimately I knew that PSSC department has cryo liquid nitrogen because they are experimenting with cryo engines. So I met the director. He was very helpful, and he sanctioned the required liquid nitrogen for us. So with each glioma tumor, at the bed of the tumor, cryo lesions are made, and it's supposed to enhance the immunological response and also increase the longevity. I completed the study and presented it in the Neurological Society of India annual conference. So I became very bold because even in that circumstances I could do research. And second, I had done many, but I'm only taking up only 2 of them. Second one was on meningioma, another tumor which is supposed to be benign, but occasionally it can become malignant one also. So to find out at the early stage itself, we did a study where you do a scanning electron microscopy of the surface of the tumor, and depending upon the pattern you find, you can predict whether it will recover or not. So here again, scanning electron microscopy in an institution which has only X-ray. Where do you get scanning electron microscopy? I searched and found out that the regional laboratory in Kerala, in Trivandrum, has scanning electron microscopy. And I had talked with the director, and he agreed. And tumor tissues were given to them. It has to be gold-plated and examined under scanning electron microscope. You will find a lot of villi, projections. Its morphology, its size, shape, number. From that you can calculate whether the tumor will recover or not. So that study was also successfully conducted. So the message I want to give is that if you have mind And if you are determined, with no facility, you can do wonders. So this is message, because research is basically required. If progress has to be there. As a doctor, you cannot stand alone and just do the practice and be with it. But these areas you have to explore and find solutions. Second challenge was that by 1994, I became the head of the Department of Neurosurgery in Trivandrum. Trivandrum Neurosurgical Department was the premier institution in Kerala. But you may not believe that we didn't have an ICU unit. Without an ICU unit, we have been treating patients. So I made a proposal for starting an ICU unit with all gadgets, monitors, and other things. Submit to the principal, health secretary, planning board. But then initially it was a failure. Nobody responded. Then I thought that this route is not going to help you. You have to think of some other way how we can succeed. And then I decided that start from the bottom and work up. Medical College, even at that time, had Office of the Electricity Board, PWD, and Water Works and so on. I met engineers. We had a kitchen which has been abandoned with a dining area, which was very huge. So I gave a proposal that this can be converted into an IC unit. Initially they were laughing at me, but then when I described what I am planning to do, they agreed. And from the fund available, they remodeled it. Only partitions in the dining hall and convert them into 3 IC units with 12 bed seats. But then space is ready, but you had to have ICU beds, monitors, central suction, and oxygen, and other facilities. That again was a real challenge. I frequently go to the health department in the secretariat, and I knew that even those departments for which fund has been allotted, at the end of the year, it is not utilized. And naturally the amount lapses. So the next I thought that with the help of the principal and superintendent, I will prepare a list of equipments required for the IC unit. And following purchase rules, the formalities were completed, and by the financial year and everything was ready. As usual, the health secretary calls the principal and says that funds are available. If you have some proposal, we can sanction it. When you go straight and ask for it, you don't get it. But this is what happens with the funds most of the time. So the opportunity is grabbed and equipment are purchased, and this process went on 1 or 2 years. By then, we had the most advanced IC unit in Trivandrum Medical College for neurosurgery, and we could serve the poor without charging them. So what I tried to say is that you have to be very critical about what is happening around, the perception that is existing, that this is a route we can go only, this is only route, is not right. Out of the box thought and activities definitely will lead you to success. So this is another message I would like to give to my youngsters, that if you are determined, doors will open and help will come from unexpected quarters. So that is to be kept in mind. So at every phase of my career, I have challenges. So then the next thing was that I completed my tenure as a director and professor of neurosurgery, and I retired. Normally when you retire, you have a sigh of relief that your responsibilities are over. Now we can sit in an armchair and enjoy life. But I decided that that is not what I should do. I have a plan of having a multi-specialty international standard hospital to be built in Trivandrum. I shared this thought with my friends, well-wishers. They said, this is an impossible thing, particularly at the age of 60, thinking of a new project, that too a project like this. They said you had to do due diligence of the organization. You had to have financial experts, feasibility study, financial viability study, appoint all other helping specialists like auditors, accountants, and things like that. If you are going to do all these things, it will cost at least 25 lakhs, and another 2 years you have to plan and do it. So that is a precious time that I cannot afford because I don't want to keep lazy. So I thought that the only way you can do it by unconventional method. So I decided to rope in like-minded, genuine, reputed doctors to this project, and they readily agreed. And we started the construction. We planned it in 3 phases. Phase 1, 100 bed, phase 2, 200, and phase 3, 350. And somehow the phase 1 building was completed. Then of course the challenge came, how to fund or finance the rest of the things, patient bed, equipment, and to have a hospital of international standard, you should have a cath lab, dialysis machines, CT scan, and and laboratory and other things. So projects were prepared, banks are approached. Normally if you approach a bank, it will take 2 years for processing and sanction. I thought I cannot wait. So I met one of the regional managers of the bank and told him that I am determined to do it. If you help me now, this project will take off. If you don't, I'm going to abandon it. Then he looked at me and thought for a while and said that, Doctor, I'm going to sanction you the amount. And that too without formalities and all. And that happened. And that's how I became an entrepreneur at the age of 60. And now it is a 350-bedded hospital with all the educational programs, including a public health institute training MBH students recognized by University of Health Sciences. And even the WHO funding is we are getting 2 crores per year. And also the NMR Prevention International Initiative, we are doing it, which also is funded. And research papers and publications definitely are coming in. So this is how, at every stage of my career, whatever challenges came, without treading the safe, conventional path, I dared, and I had my own way of handling it, and I could more or less succeed. This I want to tell you because even now the perception, wrong perception that exists. Trivandrum Medical College, you know that one of the head of the departments publicly came out saying that he will stop operating because government is not giving equipments. But then every professional, every member of the system has a responsibility to see that the system grows, right from the security up to the principal or whoever it is. So that is another message that I want to give the youngsters, that you cannot stand alone and be just a physician. The responsibility stretches beyond all its limits. Then, when I became the National President of Indian Medical Association, after critical review of the health system in the country, we could pick up a lot of areas where much more has to be done. So we had dialogue with the health minister, and fortunately he agreed, and an interministerial committee was formed, five ministries together to deal with the health issues, including supplies ministry, which deals with litigations, law ministry, which deals with violence, and every other ministry which has some role in the health. And for 3 years, the committee worked and came out with at least some solutions. All the issues which we flagged, at least for some issues at least, we could get solutions. And that way, wherever you are, whatever you do, you have to feel that you have a responsibility more than just an individual. You have a responsibility or obligation to the society, and that has to be fulfilled. I'm not going into the details of the issues in the health sector. It will be a long process. But one or two things I will flag. One is, of course, the emerging conflict, man-animal conflict. Every year, the repeating infectious diseases, including Nipah, that is happening. We have to promote One Health, where we have to realize that the health of the public, human being, depends on the health of the animals, both wild and domestic, and also the health of our environment. And without a policy of One Health, whatever effort you put in isolation in various areas, particularly in the health sector, cannot be fruitful. In the health sector, unlike other sectors where others work, the canvas is very large. We think that just looking after our patients alone is going to deliver goods, which is not enough. When you look at the environment, social determinants of health has to be addressed. Environment, water pollution, air pollution, things like that, deforestation, climate change, all these ultimately is going to affect the health of the public. So in all these areas, definitely we'll have to put our mind together and solve it. Another area it definitely requires our attention is the worsening of the doctor-patient relationship, where a lot has to be done, because in our syllabi and curriculum, emphasis is more given on the science of medicine, while the art of practice of medicine is more or less neglected. So how to be a human being, how to be an interesting human being and a doctor, the empathy, sympathy and other attitudes which are required are not really infused into our graduates, which definitely is the need of the hour, because whatever we do, we are doing much better than any other country in the world. We have friends in America, UK and other places. We think that everything is okay in those countries. Even in America, 40% of the population, healthcare is denied or delayed. And even to do an investigation, you have to wait for months. If you want to do a scan, you have to wait for a long time. But in our country, in every town we have enough of investigative facilities, and whatever you want to do, you can do immediately. So our health system is better than in any other country. We can be proud of it, but it needs change, and we have to have doctors who has a wholesome view of what is happening, rather than confine yourself to patient care alone, because the canvas is larger and the health needs can be addressed only by multi-dimensional involvement. And that is a message I would like to give to the youngsters. And think differently and act differently. And you can use artificial intelligence technologies, but they are tools in the hand of a person who has the right attitude, resourcefulness, and that again has to be kept in mind because artificial intelligence is not above you. It is a tool for you only. And also, lastly, your commitment to the society and to the country is very important. Thank you.